we don't see this incredibly huge range in how patients are treated at different hospitals because that's what patients or families are saying. We see it a little bit because of what families are saying, but there are other reasons why this is happening. Days in the hospital has to do with our doctors tell us, with how they behave. When a patient's chronic condition worsens, it sometimes seems easier and safer to put the patient in the hospital. Even though, in fact, it probably would be reasonable to start treatment in the nursing home, in the clinic, or even at home and have a home health nurse come and monitor. But if hospital beds are easily available, they're regularly available in that hospital, physicians unconsciously adapt and they become more willing and more susceptible to admitting patients into the hospital than if they practice at a hospital down the road where there aren't quite as many hospital beds per capita available, or when there aren't quite as many ICU beds available. Or so in the ICU, for example, the more beds that are available, the less sick the patients are who get into the ICU. It means that it's more available, it's easier to admit a patient. So it is possible that some of these differences are patients' preferences for care, but it turns out that when you really study regional variation in how patients are cared for at the end of life, it has to do with something that seems very, very counterintuitive. It's that the availability of beds, ICU beds, hospital beds, has a lot to do with how easily the patient is admitted into the hospital and what then happens. They get on that cascade of things, of treatments, of tests, of we can do the next thing and the next thing and the next thing. So we have this idea in this country, or we have had, I think it's beginning to change, that there's no such thing as too much medical care. And therefore, there's no such thing as too many doctors, too many hospital beds, too many intensive care units. And in fact, after World War II, the US went through a hospital building spree. And it lasted well into the 1970s. And one result is that California is carpeted with little hospitals. In fact, no place in California has more hospital beds than Los Angeles compared to the size of the population. So if you drive down surface roads in this city, you will, not on the freeway, you can't help but run into yet another hospital. They are built, they're sort of an accident of history and of government policy, of subsidies, something called the Hill-Burton Act, and because a lot of doctors settled here. And so there are more doctors in Los Angeles than there are per capita than any other place in the country. 333 patients per doctor. Now, when you have a hard time getting in to see a doctor, that might seem kind of weird, but there are lots and lots of doctors, and they are all very, very busy, and those beds are very, very full of patients, because you can't run a hospital when there are empty beds, just like you can't run a hotel when there are no guests. The difference is between a hotel and a hospital bed. As a hotel guest, you've made the decision to go stay in that hotel. Maybe it's for business, maybe it's for vacation, maybe they offered a cut rate, but you made the decision. But as a customer, you can choose to stay or not to stay, but a stay in a hospital bed is not quite under your control. A stay means that your doctor has admitted you to the hospital, which is a funny word. I always think about admitted as just like, you know, the velvet rope in front of the nightclub, and I'm getting admitted to the nightclub, only I want to be in the nightclub. But in order to get admitted, the doctor needs to decide that you are sick enough to be in a bed. And it turns out that those decisions about whether or not you were sick enough to be in that bed hinge in part on the supply of beds.